Greetings. All right, let's get started with the hip, back, and legs flow. Let's find ourselves on the ground. Let's find our seat, so to speak. And we're going to make sure that we clarify the edge of our discomfort. If there are questions at any point in the lesson, always ask yourself, does this feel safe? Does it feel nourishing? And if it does, you're great. If it doesn't, just back off a millimeter or two. If it feels like you need a little bit more edginess, go ahead and play. That's the whole focus. All right, so let's go ahead and take a few deep breaths and let's go ahead and get started. All right, we are going to start with knee to chest, pulling our knee into our chest as we extend the left leg down. The left leg is gently pushing to the floor like an arrow to stabilize the left side. And again, we are breathing in slowly, exhaling slowly. Exhale on the release, and then we come to the left side and repeat. We're going to go into directly the hip opening. Gently bring the hip out to the side, or the knee out to the side, that is. You will feel an inner thigh stretch in the groin. Again, you're using that right leg to stabilize, so really keep that noticed in the front of your mind. And as you take the breath out, we're going to go right into a trunk twist. Head can be neutral, and then the left arm extends out to get a little bit of a stretch in the chest and the pecs. Sometimes into the shoulder and even the upper arm, you may feel this. Sometimes people might feel all the way down to their hands and fingers. It should always feel nourishing. Very important. Okay, we're going to come back to the center. We're going to go right into our straight leg raising movement, which is the knee extending and flexing with our toes pointing and pulling. Okay? All right, so as you notice on my left side, I'm demonstrating just one movement, which is toes pulling. And don't worry, we're going to show it pushing and pulling on the right leg. Now, you can alternately just keep the leg up in a straight leg position and do a set of the toes moving. And this is going to really impact you greatly in your flexibility and mobility in your legs, because it stretches the calf muscles, what we call the tibialis anterior muscle, which is in the front of your lower leg, what helps you to pull your toes up. And it also gets at your sciatic nerve too. So if you've been having some sciatica, this will help to kind of grease and lube it up. Lastly, that movement in your knee affects your knee joint. So it gives it some nice range of motion in a gentle way, lubing up the joint. So now we're in our trunk twist to the left. Right arm is out to the side. Head can be turned in either direction. All right, so let's see if I'm telling you the truth. So we're going down and up. We're lubing up the knee. We're pointing and pulling. There you go. So you can play around with this, and that's exactly what I do when I work with my patients, because every session is unique, and it doesn't have to be regimented, so to speak. And so after you get to learn the movements and get them committed to most of the memory that you need, then you can start playing around with them and make them your own. All right. Now, as you find your way through these lessons in these movements, you will begin to actually work on spending more time in the stretches. So we just spent 20, 30 seconds at the most. You can increase it slowly by 15 to 30 seconds, eventually getting yourself into a 3 to 4 minute stretch. Okay. The reason for that is because our fascial system requires a long hold stretch to increase the flexibility. It's not like muscle. Muscle has this incredible contractile component to it for movement's sake, of course. And so you can actually do what we call a dynamic or ballistic stretch, and it will actually reflexively in the nervous system release or relax the muscles so you can get length almost immediately. It is not the same thing in your fascia, and that's what we're playing with today. Okay. So we're in child's pose. Went from the cat-cow, some people call it the cat-cow, and I just call it the pelvic tilt, or we can call it a poke and tuck. So we're in a child's pose. This progression is you can bring your legs further and further apart to open up your SI joint, your sacroiliac joint, and then you can add in reaching over to one side, and that opens up the whole side of the rib cage, in this case the right side. Breathe in deeply into the side of your rib cage, expand that space, get your lungs to fill and grow into that space. This actually enhances lung volume. Same thing on the other side. So another note, nice little key piece is as you're sitting back, my left bottom is pushing back to the corner wall by the light. That'll enhance that stretch just a little bit more, and it's a pretty glorious feeling. Breathing in slowly, deepening, exhaling, come back to the center, and I'm just going to drop all the way down, and we're going to go into a Spynx pose. Now, this is a little medium stretch for the back to get extension, which is the position that we're moving up and into, to enhance flexibility in our lumbar spine. We are reversing the curve of the flexed postures, flex meaning like sitting at our computer or driving in our car or eating breakfast at the breakfast table positions, okay? All right, beautiful. And we are done, and I'm just going to shut it down. All right, have a wonderful day.